Have you ever felt a sharp sudden pain on your lower back when trying to bend over? This could be a sign of serious internal injury on your lower back, and this video is all about it. We will see what could be the possible reason for it and what we can do for it at your home. So let's get started. Friends, before we proceed, I request you to please subscribe to our channel and press bell icon so that whenever I upload a new video, you will get notified and you will never miss my videos. Bending over on our lower back is a very normal activity. It is a part of our normal daily living, but at some point of life you might have experienced a sharp pinch like pain that elicits on your lower back when we try to bend over for doing some activity. This could be a sign of a serious internal injury that is known as slip disc, or we also call it as prolapsed intervertebral disc or disc hernia. So before we try to understand why does it happen when we bend over, let us try to understand what actually is slip disc. Friends, our vertebral column is made up of number of vertebral bodies. These vertebral bodies are placed one over the other like a stack of bricks placed one over the other. So between each consecutive vertebral body, there lies a disc-like a structure which is made up of jelly-like material, which is called as intervertebral disc. This disc is very important and it has a very important role in absorbing the shock of our body. Observe that how freely, how smoothly we can jump, we can twist our body without any internal damage. This when we jump, when we twist, all the shock that is absorbed by this intervertebral disc. This intervertebral disc is actually made up of layer of annular fibrosis that encapsulates the soft jelly like material that is encapsulated inside this external hard capsule, and this soft jelly like structure we call it as disc pulposus, and the external hard layer we call it as annular fibrosis. So what happened, we all do bending over activity. We bend over to pick up things from the floor, to pick up bag, to pick up heavy objects, but nothing happens. But in a particular position, in a particular posture, that happens spontaneously without our knowledge. In that particular posture, when we bend over, the excessive stress is being transmitted to the particular disc. This causes the tear of the annular fibrosis. It can be partial or it can be complete tear, but usually it is partial tear, which causes the soft jelly like material to come out of that layer, and it bulges out. This compresses the nerves that passes by, causing a sharp sudden pain when we try to bend over. So once we have developed this herniated disc, whenever we try to do activities like brushing our teeth by bending over, or trying to pick up things from the floor, or when we try to bend over by looking like this, we always feel pain or pinching like pain over on the lower back. This can be understood by this simple physics. See, our disc is already bulged, so whenever we try to bend forward, the disc is pushed backward. So as you can see in the figure, when we try to bend over, the consecutive vertebral body try to further push the disc or push the bulging backward, and that it causes compression of the nerve that passes by. So this is why whenever we develop a slip disc, we should avoid forward bending activities. So our next point is what we should do when we develop a slip disc. Whenever we develop a slip disc, first thing we have to note that we have to avoid any kind of activity that involves forward bending. The second thing is, you might be asking that how, if bending over is restricted, then what we can do if we need to take out something from the floor. At this point, I would like to tell that if you need to pick up something from the floor, you don't have to bend over the lower back. You have to bend on your knees and then reach to the floor and then pick up the things. By doing this, you are actually avoiding any bending on your lower back. The second important thing is exercises. Here I will describe 3 most important and most effective exercises for this slip disc. So the first exercise is bridging exercise. For this you have to first lie down on your back straight like this, and then bend your knees like this, and then raise your lower back like this. Hold this position for at least 5 seconds. Most easy way is to count 1, 2, 3, 4, 5 and then lower it down. Then again do it 1, 2, 3, 4, 5, 6. Do this exercise for 20 to 25 repetitions in a single session twice daily. Our second exercise is strengthening of the upper back muscles. So what we have to do is to first we have to lie down on your tummy like this. Keep your hands by your sides and then raise your chest and head like this. Hold it for 5 seconds. 1, 2, 3, 4, 5 and lower it down slowly. Then again raise your chest, hold for 5 seconds and then lower it down slowly. Repeat this exercise for minimum of 10 repetitions in a single session and twice daily. The third exercise is strengthening of lower back muscles. For this, the starting position would be the same. You have to lie down on your tummy, hands by your sides, and then raise your leg like straight like this. And you have to note that I am not bending my knee. You have to avoid bending at the knee. And hold it for 5 seconds and then lower it down slowly. Then repeat the same process on the other leg and lower it down slowly. Repeat it alternately on each legs. Do this exercise for minimum of 20 times in a single session twice a daily. Hope friends you like this video. If you like this video, please do not forget to like it and share it with your friend. And if you are new to the channel, please consider subscribing us. Thank you for watching friends. Bye bye.